Hello viewers, welcome to Health Profile. Today we are here at Sunshine Hospital. Dr. Venu Gopal Pareek is with us, consultant bariatric surgeon. Hello doctor.
Hi.
It's a pleasure having you here.
It's indeed my pleasure.
Yeah. Doctor, what is bariatric surgery exactly?
So bariatric means actually weight loss. So when we talk of bariatric surgery, we are talking of weight loss surgery. Now a lot of people confuse it with lot of this cosmetic things happening at cosmetic centers like VLCC and all this.
Exactly.
Bariatric surgery is a weight loss surgery which is done exclusively in only super specialty hospitals and not in the cosmetic centers. In cosmetic centers there are different type of cosmetic options given wherein blanket warming therapy is given. That's only a partial weight loss.
Oil massaging,
Oil massages, some dietary management things happen. So that is only for some borderline weight gain wherein you have gained 5 or 7 kgs you can lose. But bariatric surgery is a scientific way and it has been a proven scientific surgery since last 25-30 years. It is being done worldwide with millions of patients benefiting, and it is only done in super specialty centers like Sunshine. In Hyderabad we hardly have 4-5 centers who are doing it regularly in good numbers. So bariatric surgery assembles only and only weight loss surgery, and it's not a cosmetic surgery, it's a lifestyle modifying surgery. It helps in losing from 30 to 100 kgs weight which you have gained in part of your life. So with bariatric surgery you can lose that much amount of weight.
Okay, doctor, are there any types of bariatric surgery and the difference between bariatric surgery and liposuction?
So bariatric surgery, there are different types of procedures. So all the procedures basically are done laparoscopically. That means without putting any major incisions on the patient body, only through small puncture holes the entire procedure is done. Now there are different types of surgery and we recommend the type of surgery to the patient depending on his metabolic condition. Now metabolic condition means whether does he have diabetes, does he have blood pressure, does he have osteoarthritis. Secondly, it also depends on his eating habits. If a patient is purely vegetarian or a non-vegetarian, or in India we call something as a pseudo non-vegetarian. They call themselves non-veg and they eat one piece of chicken once a week. That is not called eating non-veg. Wherein in European and US standards they eat chicken every day. In our standards we eat once a non-veg and we proclaim ourselves proudly as non-vegetarians. So the type of bariatric surgery we recommend to the patient depends on the eating habits, the metabolic component. Now the most commonly done bariatric surgery is sleeve gastrectomy. Now bariatric surgeries are broadly classified into two types. One is restrictive and other is malabsorptive. So restrictive means only the size of the stomach is reduced. So initially as the patient puts on weight, the stomach size increases. So in restrictive procedures only the stomach size is reduced.
Means you cut off the stomach?
Extra stomach, yes. So this is done through laparoscopy. That's the reason patient recovery is very fast. So the patient on an average stays 2 days in the hospital, third day goes back to home, and within a week he can be back to work. So sleeve gastrectomy is the most commonly done surgery, which I just explained. Out of 100 surgeries done across India or worldwide, probably 55 to 60% is sleeve gastrectomy. So that's the most common. Then apart from that, there are a couple of other very good surgeries which are done depending on the metabolic status of the patient, like Roux-en-Y gastric bypass and mini gastric bypass. So in malabsorptive procedure, which both of them are, apart from restriction, we bypass a length of small intestine. So that food enters from the food pipe, which we call esophagus, to the stomach, the small stomach pouch which we created, and from there it directly enters the distal small bowel. So it bypasses the entire proximal small bowel. So we create a limb of malabsorption which helps in losing more weight. Now this is more helpful especially for patients who are diabetic and who take heavy doses of insulin and their diabetes is not getting cured. So when we do these malabsorptive procedures, their diabetes gets cured because of certain hormonal mechanisms that come in way. So these are two basic types, restrictive and malabsorptive. Restrictive mainly sleeve gastrectomy and malabsorptive mainly Roux-en-Y gastric bypass and mini gastric bypass. Though it may sound as surgery and scary thing when I tell, but as these are done through laparoscopy, the recovery time is almost same for all the surgeries, just 2 days in the hospital, third day to the home, and within a week you can do all heavy labor work together. Now the other very important thing which you asked is what is the difference between liposuction and bariatric surgery?
Yes.
So basically liposuction means sucking out the fat. So liposuction is good procedure only if you are like 5 or 10 kgs overweight. But in bariatric we have a certain set criteria that if your BMI is only about 27 or about 30 with metabolic components, only then we advise bariatric surgery. So a patient with a BMI of 25 or 27 can fall for liposuction. So you are 5-7 kgs overweight, 10 kgs overweight, or you are just 5 kgs overweight and with little more fat on your thighs or buttocks and or your belly at one portion, concentrated fat. For such cases, liposuction is helpful. Post liposuction, your metabolic status is going to remain the same. That means you are diabetic pre-surgery, you will be diabetic post-surgery. You had high blood pressure pre-surgery, post-surgery also you are everything. But bariatric, the difference is that your metabolic condition changes. Post-bariatric surgery, you can lose between 30-40 kgs to up to 100 kgs. The highest which we have operated at Sunshine has lost now 118 kgs. He was 210 kgs, now he is below 100.
What period of time, doctor?
In a span of 1 year. So when this weight loss occurs, there occurs reversal of the metabolic syndrome. Now what do you exactly mean by metabolic syndrome reversal is that patients who are diabetic are taking like 60-80 units of insulin, their diabetes gets cured. They can stop insulin altogether and maybe requiring a single oral hypoglycemic drug or a single tablet to control the sugar. Their BP gets controlled automatically. They can stop all BP medicines. Apart from that, patients who are taking 100-150 mg of thyroid tablets, they can taper down their thyroid medications. Patients who have obstructive sleep apnea, that means who get breathless when sleeping, their OSA comes down. Patients with significant knee pain who are not able to walk just because of weight.
Doctor, they can reduce the dose or they can stop the medicine?
BP, sugar, yes, they can stop medicine, but thyroid, the dose definitely comes down because thyroid, a lot of multifactorial pathologies are included. So especially joint pains, back pain, which are very common in females, especially infertility. We see 1/3 of our patients are young female who have got married, are obese and are not able to conceive. In fact, they go to IVF, 1 or 2 failed IVF, and then they come to us when the IVF fertility specialist recommends them for bariatric.
Because of weight, doctor?
Yes, because of the weight.
How the weight is going to affect?
Yeah, so there are post weight gain, they develop polycystic ovaries and then irregular menstrual periods. Secondly to both of this, conceiving becomes difficult. Even if they conceive, the chances of carrying on pregnancy becomes very less for them. So they get repeated abortions. And believe me, once we do bariatric surgery, automatically they conceive even without IVF. So that is the beauty of getting a bariatric surgery. So bariatric surgery is more of a lifestyle modifying surgery, whereas liposuction is a purely cosmetic thing. We are not reversing anything. We are just sucking out some fat, which again over a time period you will reaccumulate.
Doctor, as you said, there are so many types of surgeries. So which one is the safest surgery?
Right now, all the bariatric surgeries are safely done. It only requires a certain amount of practice and standardization at certain institutes. We have done more than 600 surgeries at Sunshine Hospital. We never had any mortality or any morbidity. So if you follow a set protocol and a set principles, then all the bariatric surgeries are safe. You need to properly work out the patient. You need to assess the risk factors, because here the patient doesn't think himself of sick. He comes walking, so he expects that he should go walking. So we should not think it that way. We have to extensively evaluate, because from a society perspective, they think if he is obese, that means he has everything in excess. But actually in obesity, only thing that is excess is fat. Rest, they will be deficient in everything. So we need to work out towards them. Whether it's hypothyroid, if they are deficient, we need to correct the thyroid level. Whether they have any heart status underlying. Now they may have lot of underlying heart conditions, but because they are obese, they don't walk much, they never get breathless. But when you are doing surgery, it's like a stress for the heart. So that can result in adverse cardiac implications.
During the surgery, doctor?
Yes, during surgery itself, because surgery itself is a stress thing.
Then how you manage it?
So we preoperatively work out. If we feel the heart is suboptimum, there are certain tests which we put the heart to stress and see that whether the heart can bear the stress. If the heart is not able to bear the stress, we subject the patient to angioplasty, get it corrected, and then 3 or 4 months later we operated. We had certain subset of patients who never knew that they had significant heart disease till they came for a routine bariatric surgery, and then on evaluation they were found to have significant, because of their weight they were restricted to their couch and sofas. So they never did any much work. But when you subject them to surgery or get these investigations done, then you significant heart conditions proper.
Doctor, with the bariatric surgery, how much weight loss the patient can expect?
That depends on how much weight excess he has. So supposedly someone who is in the excess of 100 kgs for his normal height, suppose his height is 6 feet, so his weight should be around 80 kgs. But supposedly if he is 180 kgs, so he is 100 kgs overweight. So in such cases, he can lose up to 70 to 80 kgs. But a female, young female, supposedly if she is like 80 kgs and her expected weight is 60 kgs, so she will lose 15 kgs or 20 kgs. It's not that she will also lose 80 kgs. That will not happen. So normally, rather than speaking in terms of kg of weight loss, we say ki percentage of excess weight. So whatever percent of excess weight, depending on the surgery, they lose between 60 to 85% of the excess weight.
So how much weight you will, means how much, what is the fat you will take out, doctor? Means at the one time only you will take the whole the fat, means you
no,
will...
we don't take the fat. As I said, we restrict it. Taking out fat is liposuction. Now this is bariatric surgery. We restrict the size of the stomach or bypass it with the intestine, depending on the metabolic condition of the patient. Now how much weight they lose, as I told, depends on their excess weight. If they have more excess, they lose more. If they have less excess, they lose less excess. So that depends on the weight of the patient.
During liposuction, we heard people died.
Yes, exactly.
So why it is happening?
See, what happens is fat as such is a collection of large amount of fat globules. So when you suck fat, if one of the blood vessels get punctured, the fat globules enter the blood vessel. Now this fat globule can traverse through the blood vessel to different parts of the body. If it enters heart, you can have heart attack. If it go to the brain, you can have stroke. If it goes to the kidney, you can have kidney injury. If it goes to the liver, you can have liver infarction. I would not name, but some of high-end celebrity female actress who underwent liposuction in US, she underwent liposuction and she had this fat embolism. But bariatric surgery, since we are not dealing with fat, we are not exposed to that risk. So we deal with stomach, intestines. We take care of high risk status of the patient and we give low molecular weight heparins to prevent coagulation in the limbs. And we take adequate care of the lungs so that they don't develop pneumonia or any respiratory complications post surgery.
Doctor, during the liposuction, what are the safety measures you follow?
The liposuction is not done by us. Liposuction is done by plastic surgeons.
This comes under the cosmetic surgery.
Exactly. Liposuction comes under cosmetic surgery and it is done exclusively by plastic surgeons. Whereas as bariatric surgeons, we don't do liposuction because we are not cosmetic surgeons. We do bariatric surgery, which is a lifestyle modifier.
Doctor, are there any side effects of this bariatric surgery?
I would not call them side effects, but if not, see, anyway, we are restricting the size of the stomach. Also, we are bypassing a limb of small intestine. So, we expect the patients to have a proper protein intake. But in India, as I said, that once the patient loses weight, they lose the contact with the doctor and they lose all their inhibitions. They are not in regular follow-up what we expect. So if they don't take a proper protein intake, they can have deficiencies of protein, wherein we see that patient develops floppy edema. Patients, when they lose weight, also have some hair loss, but usually hair loss is all reversible. So once the weight loss stops, the hair regrow again. So the most common is protein allergy, malnutrition, and then there are temporary side effects post surgery, which are common to most of the surgery when we do, like initially having some nausea, some vomiting for a couple of days, pain for a couple of days. But otherwise, bariatric surgery is very safe and without any side effects.
Doctor, with the bariatric surgery, what the patient can expect? Any advantages?
Great question. Now this would be more apt for patients who have metabolic syndrome, because till now we have had that once you have diabetes, lifetime you will have diabetes, you will have to take insulin, you will have to take tablets. Once you have blood pressure, lifetime you are BP patient. But now bariatric surgery has changed the scenario. Now once you get a bariatric surgery done, within 2 to 3 days you can stop all your insulin. 2 to 3 days, mind it, it's before the weight loss starts. So there occurs hormonal changes secondary to restriction and all other factors. So which helps in lowering the insulin uptake and which helps in reducing the dosage of insulin. So they can stop their insulin, they are switched to single oral hypoglycemic diet, and within 3 to 4 months they are absolutely euglycemic. That means their reports are like a non-diabetic patient. Secondly, patients who are taking high BP medicines, once they lose that 10 or 15 kgs in the first 1 or 1.5 months, their BP comes down to normal. They can stop their BP medicines. Cholesterol medicines can be stopped in 6 months. Thyroid medicines reduce. In fact, we have patients who are obstructive sleep apnea, are regular using CPAP. They can't sleep without the machine. And post surgery, within 3 to 5 days, they can sleep comfortably. And the best evidence is given by the patient's wife, that wife or husband, that now they are able to sleep peacefully because the patient doesn't snore. So the quality of life improves. The fertility rates have improved. So these are all the benefits of bariatric surgery.
Doctor, what is the age limit for this surgery?
Normally at our center we have an age limit of 16 to 65. We don't operate pediatric patients, or we don't operate patients who are above 70. Until unless they are like really 70 but have a physical structure or don't have any cardiac comorbidities and can be safely operated. But beyond that, we usually don't prefer operating.
Doctor, after the surgery, what is the dietary pattern they should follow?
So we have a set protocol that once the stomach is reduced, for the first 7 to 10 days they follow a liquid diet pattern. So we have a set pro forma. Our dietitians guide them to the diet which they take, which is very conveniently they can manage it at home. No need to buy expensive drinks or anything. So very conveniently you can use household things like rice water, ragi milk and all those things which we give, and this changes according to dietary pattern of the patients. Like you can't expect a South Indian patient to have same dietary pattern as a North Indian patient, and we get a subset of mixed patients. So for them, according to their needs, we taper them. So first 8 to 10 days is liquid diet, and after that it's like semi-solid diet for the next 10 days, and after 25 days they can eat regular diet. Only thing is that the quantity which they eat reduces.
Doctor, would you like to give any take-home message for our viewers?
First of all, eat healthy, exercise every day, and celebrate occasions by doing equal exercise, not just by eating sweets. Eating sweets is not healthy every time as we assume, and as a part of celebration in our Indian culture, whatever whether it's a party or a celebration, we do it by enjoying sweets. So if you eat sweets, make sure you burn enough calories so not to gain weight and not to have the metabolic implications of weight regain.
Thank you, doctor. Thank you so much. Thanks for watching this video, and don't forget to like, share, subscribe to the channel. To get latest updates and notification, click on the bell icon.
In physical sense, what is heart attack is closure of one of the artery of heart. As every engine requires a blood supply, heart also requires one kind of blood supply through which it works. If one of the artery gets blocked, it is called as heart attack.